Welcome to This Explainer. Look, if you're tuning in today, chances are you or someone you love is navigating a really complex and deeply personal intersection of health and hope. We know that managing a chronic condition like diabetes, that's already a full-time job. Add fertility struggles into the mix, and wow, it can feel totally overwhelming. But right off the bat, I want to validate those feelings. They are completely normal. And more importantly, you are not alone in this. Today, we're going to break down the science, the challenges, and the highly actionable paths forward, together, step by step. So let's just start by addressing the single most common question that brings people here. Can I still have a baby with diabetes? That question carries so much weight, right? So much anxiety, but also so much hope. And I want to emphatically tell you, right out of the gate, yes, absolutely. Your dream of parenthood is completely valid, and it is absolutely possible. Our whole journey together in this explainer is really about understanding exactly how we get you there safely. Okay, let's dive right in by defining what we're actually working with. At its core, diabetes is a chronic metabolic condition. It basically happens when your pancreas either can't make insulin or your body just can't properly use the insulin it does produce. Think of insulin like a key, right? It unlocks your cells so the sugar from your blood can enter and be used for energy. Without that key, well, the sugar just builds up. Now, we aren't here to fearmonger, not at all, but we do have to be completely honest about the biology here. If left unmanaged over the long term, this buildup can cause damage to things like your eyes, kidneys, heart, blood vessels, and your nerves.
But, not all diabetes is exactly the same, and understanding your specific type is incredibly empowering. Let's look at how they compare. First, there's type 1. This happens when the body produces little to no insulin. It usually shows up in kids or adolescents, though it can actually develop at any age, and it requires a daily dose of insulin. Then we have type 2. This is where the body just cannot make use of the insulin it produces. It's definitely more common in adults, particularly folks who are middle-aged, overweight, or older. And finally, gestational diabetes. This develops specifically in some women during pregnancy. Now, it usually disappears after the baby's born, but it does increase the risk of developing type 2 later in life. So take a quick second to identify where you fit. Knowing your starting point is exactly how I map your medical path forward.
Section 1. Impact on women. Let's see how this all builds, looking specifically at the impact on women. Like, how exactly does diabetes interact with the female reproductive system? I want to walk through these biological hurdles carefully, because understanding your body really is the first step to supporting it. For women, especially those with type 2, diabetes can increase the risk of high levels of body fat and obesity. And this is a crucial point, because carrying extra weight often brings a higher risk of hormonal imbalance. When your hormones are out of whack, your menstrual cycles can become irregular. That makes it difficult for your body to release eggs, which is what we call reduced ovulation. On top of that, diabetes can lead to an unhealthy womb lining. That makes it harder for a pregnancy to settle safely, which unfortunately increases the risk of miscarriages or a complicated high-risk pregnancy. It can also cause sexual dysfunction, making intimacy difficult. Look, I know this list looks daunting. It really does. But please remember, these are biological reactions happening inside your body. They are not personal failings. And that brings us right to this beautiful, critical fact. I actually want to pause deliberately just to let this sink in. It is absolutely possible for diabetic women to conceive naturally. Despite all those biological hurdles we literally just talked about, your goal is highly achievable. This isn't just blind optimism, folks. This is clinical reality. Section 2, Impact on Men. Now, you might hear a clinical term that sounds, well, kind of intimidating, retrograde ejaculation. But really, this is simply a condition where semen, rather than exiting through the penis, actually enters the urinary bladder instead. I know, it sounds like a lot to process, but it's really just a mechanical ejaculatory problem that can be caused by diabetes. It's just a medical hurdle, plain and simple. So let's look at why things like retrograde ejaculation even happen. Building a family is a shared journey, right? So it's just as important to look at how diabetes affects the male reproductive system. And we're going to use that exact same compassionate, judgment-free lens. The core issue here is that diabetes, when it's unmanaged, can impair blood circulation to the organs and potentially cause nerve damage. And because of that impaired blood flow and nerve damage, men might experience difficulty having an erection or difficulty maintaining one. And as we just learned, it can lead to ejaculatory challenges too. I'll say it again. These are not reflections of your masculinity, no way. They are direct, manageable symptoms of blood circulation and nerve issues caused by your blood sugar levels. Section 3, Managing your health. Okay, so how do we actually manage those levels? We are shifting right now to the highly actionable daily solutions that you can control. First up,
eat healthy foods and really learn how they affect your blood sugar. Second, get out there and engage in regular physical activity. And third, take your prescribed insulin or other diabetes medications. Literally, that is your management plan. The primary goal of all three of these steps is actually beautifully simple. Just keep your blood sugar levels within a normal range. You're just using diet, exercise, and medical support as your everyday tools to build a really safe, healthy environment for a future pregnancy. Now, to help with step 1 of that plan, we do need to understand a little bit of nutritional terminology. High glycemic index foods. What are these? Well, these are your sugar-loaded beverages and junk foods. And why exactly do we want to avoid them? Because they release really high levels of sugar into your body over super short periods of time right after you consume them. Diet awareness is literally a massive key to your diabetes management plan. Keeping these high glycemic foods off your plate, it is one of the single most effective ways to maintain that steady normal blood sugar range we are aiming for. So the absolutely crucial point here is the number 3. Why 3? Well, because it is highly recommended that your blood sugar levels are kept near normal for ideally 3 months before you even begin fertility treatment. Think of this number as an empowering, concrete milestone. You aren't just sitting around waiting, you are actively preparing your body's foundation for exactly 3 months to give yourself the absolute best possible chance of success.
Section 4. Your path forward. All right, having prepared that foundation, let's talk about clinical care and the exciting road to parenthood. You do not have to manage this journey alone. In fact, at places like ART Fertility Clinics, experienced doctors will work in direct collaboration with diabetologists to ensure that you get the absolute best care. This is exactly how modern fertility treatment works. It's a complete team effort. You have fertility experts working hand in hand with diabetes specialists to look at your whole picture, entirely united around your health. So, our ultimate conclusion today really comes down to a simple, incredibly hopeful equation. Well-controlled diabetes plus the most suitable fertility treatment equals enhanced chances for a safe, healthy pregnancy. By taking control of your daily management and partnering with a collaborative medical team, you are literally stacking the deck in favor of your growing family. Which leaves us with one final thought today. Are you ready to take the next step toward growing your family? Because you have the knowledge now. You understand the biology. You know the exact daily management steps, so the next move is simply reaching out to a collaborative care team to begin your hopeful journey. Thank you so much for joining me for this explainer, and I wish you the absolute best on your incredible path to parenthood.